Good afternoon, everyone, and welcome to session 1. The topic of session 1 is nutrition, sustainable consumption patterns, and food economics. It relates to the first 2 action tracks of the UN Food System Summit, as we have seen it before. So it's about access to safe and nutritious food. It's about sustainable consumption patterns. So this session shall remind us that well-functioning food systems do not only rely on food production, available food, but also on access, utilization, and then corresponding nutritional outcomes. So all our contributions are somehow located in this complexity, food system complexity. I'm very much looking forward to them. Before starting directly with the first contribution, just to remind us of the housekeeping rules in this session. So everyone has 20 minutes, a maximum of 15 minutes of presentation. And then we have 5 minutes of questions and discussion. So the audience, please hold your questions until the end. We will consider both the questions from the audience on site and questions from the audience online. So just post your question to the chat if you're attending us online. We have online audience, Melina. How many? Just to have an idea how many people are attending this session.
Around 30 people.
Okay, so it's a big session. Very much looking forward to the presentation. So for the presenters, you can continue here on the slides, so you do not have to modify anything. Everything is ready. We will start with Jacqueline Ribéry. She will tell us something about linkages between cultural factors and dietary diversity in Madagascar. Jacqueline is a nutritionist and dietitian by training. She's research experience in Africa, is currently working as a health promotion specialist in Switzerland at the cantonal level. Jacqueline, the floor is yours. One more organizational issue. So please rephrase questions from the audience on site such that the online audience can follow my tips.
Thank you, Filippo, for the introduction, and thank you also for the invitation. And hello, everyone. So subsistence farming, as well as the availability of food on the market and its affordability, has a great impact on the nutrition in Madagascar. Especially for young children, a diverse diet is crucial for their physical and cognitive development. So the focus of this joint research project between the BFH Havel and the School of Agriculture and Environment Studies of the University of Antananarivo and INASU was the exploration of cultural influencing factors on dietary diversity in Malagasy children. It's a great pleasure for me to introduce you the background and the results of this research. Madagascar is a large island with around 28 million people, from which about half are below the age of 18. Most people live in rural regions and live from less than $1.90 per day. Around 70% work as smallholder farmers. Unfortunately, almost every second child below the age of 5 is stunted. Stunting is a common form of undernutrition, which denotes growth failure in children, making them too small for their age and hindering them to reach their full cognitive and physical potential. It's also an intergenerational cyclical process, which is difficult to break, and it can have a negative impact on a country's long-term progress. It's a key target under Sustainable Development Goal 2 to end all forms of malnutrition, including stunting. The causes of stunting are very multifactorial, and it's therefore linked to several Sustainable Development Goals, as for example also to end poverty or to achieve good health. The determinants of stunting are country, community, or even family specific. Hence, I like to present some main determinants of stunting in Madagascar. Already the area of residence is a factor which influences the stunting risk. It's higher in rural regions. And with around 65%, the highest prevalence is seen in the Vakinaka-Ratra region. Research has pointed out that the age of a child is another risk factor. It's particularly high in children between 12 to 35 months of age. Anemia is another risk factor. And when considering the feeding practices, low dietary diversity is linked to a higher risk of becoming stunted. These diets consist mainly out of very carbohydrate-rich foods and are poor in animal-based products. In families with low household wealth or low educational level of the caregiver, the risk for not receiving a diverse diet is higher. Caregivers' conception of child growth, malnutrition, and health are culturally bound. Hence, cultural constructs affect complementary feeding practices. Interventions for the prevention of childhood malnutrition often address its determinants, though additionally, for being effective, these strategies need to be aligned with cultural models in each community. Due to this aspect, the main research question was to find out what impact do cultural habits have on the dietary diversity of children between 6 to 59 months of age in the Vakinaka-Ratra region. Here on the picture, you see the included communities. The lines are the main roads. So Ibiti is the most remote community here. A mixed method approach was used in this study. Qualitative data was collected with 3 methods in all communities: a transect walk, 2 focus group discussions, and personal interviews. Within the personal interviews, a quantitative assessment of the infants and young children's feeding practices was surveyed based on the WHO recommendation. In each community, data from 20 children were surveyed. It covered the following 4 indicators: minimum meal frequency, which depends on the age and breastfeeding status of the child. And with the interactive tool you see on the picture, it was easy to find out if the child was still breastfed or not and how often it received a meal or a snack. And minimum dietary diversity was calculated through the dietary diversity score. Here you see the 7 food groups. You see 8 pictures because I split the vitamin A rich fruits and the vitamin A rich vegetables in 2 different pictures, but it was still treated as 1 food group. So the consumption of each food group is rewarded equally with 1 point. Adding up all points of the dietary diversity score, a sum of minimum 4 classified a child as reaching minimum dietary diversity. Children reaching both previous indicators were counted as having a minimum acceptable diet. And as a 4th indicator, the consumption of iron-rich or iron-fortified food was elevated. Now I'd like to present the results to you. Almost all people had access to an agricultural plot and grew between 2 and 8 different crops, mainly rice, cassava, beans, tomatoes, peanuts, or maize. As most crops are planted during the start of the rain season, the success of the harvest highly depends on the weather conditions. The crop diversity was lowest in Ibiti, and also most people own livestock, mainly chicken or pigs. In all communities, rice was highlighted as the most valued food. As you can read in the quote, it is from some people seen as healthier than other food, and that they would, for example, also sell a chicken to buy rice from the profit they get from the selling of the chicken. Mothers are most commonly responsible for the children's diet, especially in Behensi. In the other two communities, participants mentioned that both parts of the parents have the same responsibility. When considering what food is given to the young children, parents are influenced by relatives, by neighbors, health and nutrition workers. Even though many participants had only primary education, they had a rather good knowledge about child nutrition, and they mentioned that they gained it through trainings from nutrition workers. But due to financial constraints, food, which is important for the development of the child, is often not affordable. And additionally, rumors or taboos hinder some people on giving a certain food to their children. Such rumors differ in communities and also between families. You can see one rumor in the quote here. This was a quite common rumor in the region. Considering the food procurement and consumption in a household, there are several issues which influence a child's diet. Despite many agricultural activities, the self-supply does not last for a year, and food prices are higher in the lean season. All communities have a weekly market day, and participants mentioned that they would buy certain food, such as fruits, dairy products, meat or fish, only at that specific day. And of course, also only if the money is available at that day. At special events, meat, vegetables, fruit juice, something not ordinary is often planned for food, and therefore people save money. For yearly events such as the Independence Day or Christmas, a time span of around 2 till 4 weeks is needed for the saving the amount of the money. But for bigger events such as the Famadiana, a ritual reburial of the dead and a very important tradition in the region, more time and more money is needed. But whether special events have an influence on the daily nutrition is quite family dependent. Some highlighted that only adults have to reduce their food portion during the time when money is saved. Whereas others clearly stated that also children have to eat less. For the preparation of the Famadiana, more participants highlighted that also children have to eat less diverse and over an expanded time span, such as 1 year. So here you see also a quote which highlights this topic. This table here shows the summarized results of the assessed indicator, split by communities and by the age groups. It highlights that minimum meal frequency, here in the first, it highlights that minimum meal frequency was the indicator which was best reached, especially in younger children, and without great differences between the community. More differences were seen in the minimum dietary diversity and minimum acceptable diet indicator. For both indicators, Ibiti reached the lowest numbers compared to Ankara-Mirouge. Interestingly, on a percentage base, less of the older children reached a minimum acceptable diet. Also, less of the older children, like the children above 2 years of age, received an iron-rich food. As the main research question was linked to the dietary diversity, I like to show you more results in this graph. Unfortunately, we don't see it here, but here would be the food group of eggs, which is extremely low. All children received food from the food group cereal, roots, and tubers. Most often it was rice. Also, vitamin A-rich vegetables, mainly green leaves, were given a lot. Though on the other side, dairy products and eggs were not given by many participants, and it was especially low in Ibiti. This study demonstrated that children's diet is largely dependent on their parents' agricultural production and on market purchases. Market days could bring a relevant benefit of the dietary diversity if the present food is also affordable. And most participants had a rather good knowledge, though nutritional impacts due to rumors or special events are family dependent. And a negative impact on a child's dietary diversity due to Famadiana might last a year, which should not be neglected in the setting in this region. Dietary diversity scores were similar in younger and older children, though less children above 2 years reached a minimum acceptable diet due to not reaching a minimum meal frequency, as 3 meals were not sufficient when the child above the age of 2 was not breastfed anymore. Yeah, now we even have a new context, and COVID-19 most likely increases the challenge for people to have access to safe and nutritious food, what therefore may lead to an increased prevalence of stunting and other forms of malnutrition. And due to the current circumstances, it seems even more important to take action now. And with this aspect, I would like to thank the Cecchini Institute for providing the opportunity to discuss and talk about how applied research can address the food and climate emergency. There are many challenges without a one-key-fits-all solution. Therefore, projects should strive towards interdisciplinarity and multi-sectoral as well as participative approaches, so that people from various fields can work together and receive a broader picture, which allows to find together suitable solutions for such complex topics. I would like to thank everyone who was involved in this research. And also thanks for your attention, and I'm happy to discuss the questions.
Thanks, Jacqueline, for the presentation. So the floor is now open for questions. I would say that we start here in the room. So please go ahead if you have questions or comments.
Many thanks. Really interesting analysis. I think it's a typical picture of how it looks like in such countries. So I ask you an imaginary question. Imagine yourself, you're a local or a national politician, and you have just 1 or 2 measures you might be able to influence a little bit. Not a project where we can touch everything. You have little resources. Where would you start first to influence, to increase or to improve dietary patterns among these children, these risk groups?
Okay. I have to repeat the question. So I should imagine if I would be a politician in this country or in this context, which measure would I do or what would I change? So when I wrote the discussion of the paper, I found several interesting topics, and one which seemed very reasonable was linked to the flooded rice field and to have fish in the rice field, like to do an aquaculture in the rice field. And I thought it's linked to the cultural situation that people eat a lot of rice, because it's difficult to change that from one day to the other, just because the problem is if a child eats really a lot of rice, there is less space in the small stomach for all other nutritious food. So I found this would be an interesting thing to change. And also the fortification is a topic with micronutrient powders. As long as they would be available for free, people told that they give it to the children, but at the beginning they are always very skeptical if it doesn't make the child sick, because the cultural background is not that they trust in such a thing. So if there are communities where, for example, the food nutrition worker is really standing behind a specific topic, then it's easier for the mothers or for the parents to apply it. So yeah, and if it's available. I hope it answers more or less the question.
There is no.
There is no
quick fix for that.
Yeah.
Yeah, I'm curious by the comment about the eggs.
Yeah.
So we've seen that in other countries as well, where there's some kind of a taboo or a tradition related to giving eggs to children. I think it was in Nigeria where some respondents said that they didn't give eggs to children because they would make them a thief.
Yeah.
And so I've often wondered whether those traditions don't stem from the affordability of the food card.
Mhm.
And just for curiosity, whether you got into or discussed with the participants why there's that connection between eggs and something bad happening to that child. And whether there's some element of their availability or their affordability or something that has led to that.
Yeah.
To those taboos or,
Yeah, we were first in the most remote community in Ibiti, and there it was quite common to hear the rumor. Like some people would say, the child, if the child cannot speak yet, it's not allowed to eat the egg, but as soon as it speaks, it's allowed. So it's just this specific point. But the problem is, if the development of the child is not so fast, then the child is older when it starts to speak. And so it was always linked to the point of when the child would speak. And interestingly, many people have chicken, but they keep the eggs for being hatched, so they grow new chickens. And some people mentioned that they would only eat eggs from their own chicken if it's accidentally broken. But in Ankara Miruç, the community where the dietary diversity was higher, and where I could also see from the nutrition worker that she was very keen on promoting also food which has diverse color, like colorful food, that the plate is not only white but has all the different colors. There it was different. Like people would say, yeah, we take 3 or 4 eggs from the chicken and we eat it. So that was like the only community. And there it was also less with the rumors. Yeah.
Thank you very much. So for the sake of timekeeping, we will proceed with the next presentation.
Yeah,
Thank you very much.
Thank you.
So our next speaker is Tanya Bar-Yeki. She's a nutritional epidemiologist working for Swiss Tropical and Public Health Institute. Welcome here at Zollikofen. She will speak about nutritional status in urban populations in Kenya. So we'll touch on different topics as multiple burden of malnutrition, etc. And it's part of a bigger new SDC project, and I think you will tell something about that. Tanya, the floor is yours.
Okay, thank you very much, Philippa, and welcome everyone. I would like to speak about the NICE project. It's an acronym for Nutrition in City Ecosystems, and it's a SDC funded project. Okay. So as we heard already before, like a suboptimal diet is responsible for 1/3 of the world population to be suffering from malnutrition, and even for 1/5 of all adult deaths estimated. And over 2 billion people do not have access to safe and nutritious food. And as we heard before as well, COVID-19 only increased that problem. On the environmental and sustainability side, food systems are responsible for almost 1/3 of all greenhouse gas emissions globally. Also, the overuse of the natural resources and the pollution of water, soil, and air derived from food systems, and also monoculture and decrease a lot of biodiversity. Only imagine that 12 plant species and 5 animal species provide 75% of all human food. As a result of urbanization, the majority of urban inhabitants nowadays live in so-called secondary cities. So what are secondary cities? They are the fast-growing urban areas in low and middle-income countries experiencing unplanned growth and development. So the population of secondary cities ranges between 10 to 50% of those of the capital cities of the countries, although some can have a smaller population size. These cities are unique in their environments, that they have generally been poorly mapped, and so there is limited data and information on infrastructure, land tenure, and planning. Women and youth play a key role in sustainable food systems, as we have heard already before by Lynette's presentation. This project really lays a focus on women and youth and other vulnerable populations. And I'm looking forward to your publication in this fall, Lynette. Yes. So the NICE project. The vision of the NICE project is that inhabitants of city regions demand and access healthy diets that consist of nutritious, safe foods that are locally produced according to sustainable agroecological principles. So to respond to this increase in demand from the consumer side, the farmers and the food producers, local entrepreneurs and startups along the value chain, so from the field, from production to distribution, to the markets, to the consumption, but also to waste management, have also to increase their supply. All this has to be done while encouraging the entrepreneurship of women and youth. So that's a bit in a nutshell, the NICE project vision. We are currently in the inception phase of this project. So the project aims to start in August this year. But nevertheless, there are many activities going on to be prepared for the project starts. So we are dealing with 3 countries. It's Bangladesh and Rwanda and Kenya, and 6 cities. So two secondary cities in each country. The NICE follows a context-sensitive approach, which takes the opportunities and bottlenecks for a change in the food system in each of these cities into account. So in this preliminary phase that we are currently in, we did a lot of activities such as stakeholder mapping in the cities, also a consultation process, and one of the outcome you can see here are fact sheets that were produced with city-specific data. And then also we did a preliminary data analysis to really look at the nutrition status of the city population. And this preliminary data collection, I would like to show you a bit. Actually, the intention was that I could show you much more data now, but due to lockdowns in all the countries, we are a bit delayed, but currently Kenya has finished data collection, and Rwanda finished just on Sunday, and Bangladesh is still, the data collection is still going on. But I will show you whatever we have now. It's still interesting data. So what's the rationale for this nutrition status assessment in this secondary city population? Data on city population and on specific city populations are really scarce. lot of the data really derive from rural populations or countrywide. But the dual or triple burden of malnutrition, so the overnutrition and the undernutrition or micronutrient deficiency, being together in one individual or in one household or in one city or country, is really affecting also the urban areas. And as I said before, COVID-19 really increased that issue. So what did we do? We visited in each of the 6 cities 150 to 300 households and conducted a household dietary diversity score. And so to assess what kind of food groups were processed and eaten in the household the past 24 hours. We also did minimal dietary diversity for women. Actually, we used the DQQ, Lynette, that you mentioned. To assess what kind of food the women of reproductive age of the household ate the previous 24 hours. And then we did a household food insecurity scale. We asked whether they had to reduce the size of their meal, whether they had to skip meals or go to bed hungry. And we did ask this for the current situation, but in order to have a bit of a feeling about the impact of COVID-19, we also asked what was the situation pre-COVID time. And then we also took anthropometric measurements of all willing household members to be able to assess the prevalence of stunting, wasting, under and overweight. We asked many more questions. It was like a 1.5-hour questionnaire. So we also covered socioeconomic situation, share of food expenditure on local healthy food, and consumer behavior or land access and agricultural question. And then we also visited the antenatal care clinic in the cities to get some data on birth weight, so low birth weight prevalence, and anemia data for the pregnant women visiting the antenatal care clinic. And this data I can show you already. So that's the Kenyan data for the antenatal care clinics. It's prevalence data collected from January to March this year in the 2 cities in Kenya, so Busia and Bungoma. And we could see that the low birth weight, so being born with a birth weight below 2,500 grams, is 8.1% in Busia and 6.3% in Bungoma. If we compare that to the figure reported by the Global Nutrition Report, it seems to be slightly better in a city population. And then we also looked at the anemia level of pregnant women. So there the cutoff is 11 grams per deciliter for the hemoglobin value. And we saw that 24.1% of the pregnant women visiting an antenatal care clinic in Busia showed anemia prevalent anemia, and in Bungoma it was higher, it was 30%. It's a bit difficult to compare this with the countrywide data because it's not these are not pregnant women that were covered in this 27%, but it seems to fit in with our numbers. So here are some impressions from the data collection in Rwanda and in Kenya. I think all of you who already measured infants know how difficult it is to really weigh them and measure their length. In the middle, you can see the data collection of the household questionnaire. So we used ODK and tablet-based entry of the data. And yes, I would also like to introduce now the consortium of the NICE project, because we are many institutions and consortium partners. So it's the Swiss TPH is Helen Freitag's group from the health system unit. And then it's Professor Johann Sick's group from ETH Zurich. And then we also have 2 foundations in the project. So it's Syngenta Foundation for Sustainable Agriculture and it's Sight and Life. And for the Kenyan data collection, the implementing partner were the Kulevyema Center of Food Economics. And with this, I would like to thank you for your attention. And I'm very interested for your inputs and suggestions and questions.
Thank you very much, Tanja, for the insights into the nice project, nice acronym. The floor is now open for questions. We start again with the room first and then move on.
Me again.
Yes.
Many thanks. It's a very at the very beginning.
Yes.
This program. Your objectives you showed were quite, how could I say, it was quite an overview of the objective. Have you already identified pathways where you want to test out? Here you have mentioned many things, value chains, different, let's say, different areas you could work on to influence. Because right now what you said is just we're gonna collect the data from these children, but later on we will try and test out where to interfere to influence all the way to all the health data. Have you already identified where you want to go next? Because the outcomes you have presented were quite generic.
Yes. Okay, so the question is to be a bit more specific on the potential intervention that we would plan. So, and for this, I really have to disappoint you a bit because it's still very broad, and we really need to analyze first the data that we collected now. But this is just the nutrition status data of the population. It's not like a baseline for the entire study. So it's really like there are many more activities going on currently to really assess potential bottlenecks and challenges and opportunities. And also in the questionnaire, we cover a lot of topics where we ask also the population where they think they are the hurdles for them to really get nutritious food, whether it's like they are not there at the market, whether they are too expensive, whether the knowledge is not there. So it's really first we are really in an exploratory phase to see where we can really have our interventions. And then, of course, with this diverse consortium, everyone has their own interests and brings their own ideas for possible interventions. But at the moment, we don't have yet concrete interventions ready.
More questions from the audience.
Sorry, I'm just curious about how to get involved, like the people, because you are presenting a project, you are like going to their house and so on. So how do you get these people on board so they participate and take the surveys and the measures and?
You mean now in the nutrition status survey that I presented? Well, it's just actually the people were very much wanting to participate, but we, as in every research study, we go to the chosen household, which are chosen randomly, present the study and ask if they are willing to participate, and if they are, we collect the data. But we actually had even sometimes the issue that everyone really wanted to participate. Everyone was also in the household, everyone wanted to get measured. And this takes quite a lot of time. So it was very well received, actually. Even also we were a bit reluctant because of COVID-19 times, whether you just enter the household of people. And but it seems that we really have had good field teams that presented the study very well. And they also took a lot of preventive measurements, like wearing masks, sanitizing, very hygienic measurements, that they were really well received by the population. I hope this answers your question. Or?
Yeah, I just was thinking about the duration of the survey, because
yeah,
in the first presentation, actually the issue was time, so there were like 3-minute survey, what we like 1.5 hours.
Yes, it's a really long time, but actually it was very well received. We had so few rejections, so yes, people really yeah, I can just say we were very happy and lucky that it was well received.
Yes, thank you for your presentation. I have a question about this. You are talking of interdisciplinary research and different partners having different interests, values, habits, methods, working together. So what were the challenges in that conversation?
Yes, the challenges are also the opportunities.
Quickly rephrase.
Yes, so the question is like this diverse consortium with all partners having their own interest, like what are the challenges to bring everything together? So yes, I think already in the writing up of the proposal, we just had a really good exchange. The group, we met regularly and everyone presented their interest, but it's really also needed because we really want to tackle the entire value chain. So actually the outcomes, the 4 outcomes I presented are really, each institution takes the lead for one outcome and can bring its expertise in these outcomes. But we really want to have this interlinkage and yes, to work together because nutrition is just the link for the agricultural side. And so we really, I mean, it all goes together and we really want to keep that spirit, which is currently very well maintained.
Other questions? Otherwise, I will abuse my right as moderator, ask a question myself. You said that the survey in Kenya is more advanced or already finalized. So, and there are different components of the survey, like the health facility part, the population survey part. So, can you already give us some insights on how the situation looks, how variables are associated, like how socioeconomic status correlates with other outcomes, or is this too early? I'm just curious.
This is actually what I wanted to do here, but it's really too early because we just have the raw database and we will work on it like as soon as, like from next week onward. So yes, it's really too early, I'm sorry.
No worries. And then I have a second question. So, I mean, it's see the multi-sectoral setup, interdisciplinary setup of this project is very ambitious, but also very desirable for achieving food system strengthening. So it's really required. But as Dominic said, I think there are a lot of obstacles and challenges. Regarding the monitoring and evaluation part, is there also other components planned, for example, for the value chain components, for the production components? And then will these data be merged into a single monitoring and evaluation system, or will this data be collected separately and analyzed separately? So how does that work, the full monitoring and evaluation?
Yes, so maybe I need to rephrase the question. So it's basically on the monitoring and evaluation system with all this diverse data. And this also, we are currently setting it up, but it should be like a central database where we collect all the main indicators over the log frame, like over the study that we, so like all covering all the areas because they are also interlinking, and so we can check for correlations.
So analytically, you will be available to link different thematic areas or domains.
That's the aim. That's the aim. Yes.
Okay, very ambitious. So there's time for one more question. Otherwise, we will move on with the next presentation. Thank you very much, Tanya. So the last presentation, we will stay in Africa. We'll go to West Africa, Côte d'Ivoire. Lucille Galifa will present her study on the linkages between small-scale production systems and household-level food securities and rural areas. Lucille Galifa is an agronomist with a strong interest in interdisciplinary multi-sectoral research. She's currently employed at HAFL. And Lucille, the floor is yours.
Thank you, Filippo. Welcome also from my side. I will present to you this research project in that identifying farm-level pathways to household food security in West Africa, where I did a qualitative case study in Côte d'Ivoire. This is a joint research project developed with Centre Suisse de Recherche Scientifique en Côte d'Ivoire and BFHA Havel. Centre Suisse has a long experience in this setting in health and sanitation, and they are interested in understanding how they can link this data they have a knowledge with the food system, how the small-scale farming system are translating to better nutrition and health in this setting. So I will say a few words about the context, my research question, the methodology used and the results derived, and the policy implications, and a few words on the conclusion and next step. So Côte d'Ivoire is in West Africa, and this research took place almost, a bit nervous. So Côte d'Ivoire is in West Africa, and this research took place in Tabo, which is a south-central Côte d'Ivoire. And it's between two agroecological zones, the Guinean savanna and the humid forest. Côte d'Ivoire is a low-medium income country where 2/3 of the population works in agriculture, and this is also the case in Tabo. Food security is a very complex concept, articulated around 4 dimensions: food access, availability, stability, and utilization. Food security remains an issue in Côte d'Ivoire with a country global hunger index score classified as serious, and food insecurity is worse among agricultural households, and malnutrition affects all age groups, and particularly women, lactating women, pregnant women, and girls, and young children, of course. UNICEF has developed the first multisectoral conceptual framework of malnutrition, showing the underlying factor influencing malnutrition. There is a wide recognition that agriculture has an impact on food security, but there is still little evidence that proves farm-level pathways to food security at household level. So this research used the sustainable livelihood approach to identify farm-level pathways to household food security with 3 main research questions: what key assets influence farm-level pathways to household food security? How do key contextual elements influence this pathway? And finally, can this pathway be identified discussing livelihood with farmers? So these are the main elements of the sustainable livelihood approach, with the livelihood assets in the middle, as it is a people-centered approach with social, human, financial, and natural capital. And this is in interaction to the broader context, the vulnerability context, and transforming structure. And through this interaction, translate in better nutrition or income. This research focuses on nutrition, food security, but this is undissociable to other outcomes such as income. Let me shortly introduce you to the pathway concept. This is what has been developed based on the UNICEF framework I just mentioned. We will go into the detail later on. I just want to show you that this concept shows how household assets and livelihood farming systems translate into better nutrition, highlighting the pathways and how the contextual elements influence these pathways and where. So I slightly adapted this framework to this research, highlighting the element from the sustainable livelihood, and here, and also adding the 4 dimensions of food security. For data collection, I used the sustainable participatory rural appraisal method in 14 individual interviews with farmers, men and women, 3 key informant interviews from the health sector, rural development agent, and the cacao cooperative. I did 4 focus group discussions, 2 with men and 2 with women, and many observation and field visits. Then I had to come back to Switzerland due to COVID, and the local partners continued with 10 structured individual interviews and 8 women dietary diversity score. All interviews, they were recorded, then transcribed, and then coded using using MaxQDA, and then content analysis, organizing the script into the predefined categories of the sustainable livelihood approach, and then in the second step, deriving the pathways. And then I triangulated all the data source for validity checking, seeking complementary information and deepening the understanding of food security from the people perspective in the region. About the farming system, before I go to the pathway, so it is a rain-fed agriculture. Farmers rely on rainfall for production, and every single farmer is engaged in cocoa production, which is on-demand responsibility. And the major staple crop for Baule, which are the local farmers, are plantain and cassava, and for Gyula, which are the immigrant farmers coming from the north, this is maize and rice, and this is under women responsibility. And they also intercrop vegetable within these staple crop fields. So now going to the pathways, I will just show you the key elements from each pathway. So the first and obvious and most direct pathway is agriculture as source of food, with the main food crops, staple crops. Few households also have chicken and small animals, mostly the Gyula, the immigrant farmers, and they still rely on hunting also. And this informs us about food security, about the dimension of availability of food security. The second pathway is food crop marketed. These are the field surplus that are marketed on a weekly basis on the local markets, and women, they use this revenue to buy fish, which is very important for the nutrient intake. And then we have the cash crop, mainly cocoa, which is on the main responsibility, and they always say that they divide the revenue in 3 parts. 1 part go to health, 1 part go to education, and 1 part go to leisure time. So this informs about the utilization dimension of food security. And very interesting is that when women engage in more remunerative activities such as transforming cassava in the local couscous, attiéké, they invest this money into children education and health, which shows the importance of mental accounting in this region. And the last pathway is the women empowerment, as they are very important in each previous mentioned pathways, and also as pathway themselves, but this was not deepened in this study. Regarding the contextual element, climate change is what most worries the farmers, since the rainfall is coming later. It has a huge impact on their productivity, on food crops and also cash crops. And the land conflict is also the second most mentioned issue. This is within family, as women have very difficult access to land, so between brothers and sisters, between families as they fight for the delimitation of their lands, and also within communities as the immigrant farmers do not have access to the lands. This research also highlighted that cocoa is very well supported by various stakeholders, and there is absolutely no support for subsistence crops, which are very important for food security. And it was also highlighted that the high cost of health services and the drugs, the cultural preferences for traditional healers, the lack of awareness, and the information about health, nutrition, hygiene implies a negative impact for household health stages. So agriculture policy targeting food security should pay special attention to gender roles, who does what, intra-household dynamic, who decides on what, and mental accounting, which revenues goes to which expenditure. And high investment is needed in subsistence crop. Research and development should focus on climate smart technology to mitigate the climate change impact. And with, of course, a special focus on women, since they are the one responsible for these crops. And tackling the land rights issue is a prerequisite for a successful, sustainable, and equitable rural development in this region. High investment in this region is needed in human capital. There is a need for a preventive measure with a focus on young women. They need to have knowledge on good nutritional practices, promoting local and nutritious food, and health education, hygiene, and good care practices. And finally, combining the livelihood approach, which is a holistic approach, with the pathway perspective, which is more systemic approach, enables to identify and prioritize relevant policies for improved nutrition. The livelihood approach points out underlying mechanisms which are important to understand, and the pathways indicate the key milestones which can be measured and monitored in order to monitor changes along the impact pathway. And agriculture, of course, in this region has a major role to play for food security, mostly in food availability, stability, and access and stability. But to translate all these efforts in improved nutrition, they need good health and nutrition education. And women are at the center, at the interface between this health system and food system. For further research, it would be important to explore the interaction between food and health system to further develop the political recommendation, better understand the synergy, and explain obstacles in food and nutrition policies to find the effective policy levers to empower women in the food and health system. I want to give a special thanks to all the farmers who gave from their time to explain me their livelihoods, and you for your attention. Thank you.
Thank you very much for the presentation, and again, I open the floor for questions and comments. Yes.
Hi, I'm curious, the work that we did with cocoa farmers in Ghana, there was a real challenge with the youth leaving the community. And I think in that context, it had a lot to do with the same land tenure issues that you're highlighting and the perceptions of lack of opportunity. So I'm curious whether that didn't seem to come out specifically here, and I'm curious whether you face that and whether this community is facing a similar set of challenges related to
Excuse me, what was exactly the challenge with this?
That the youth are leaving the cocoa farming community because of perceptions of lack of opportunity, or real lack of opportunity related to the land tenure issues.
This is a good question. So the question is whether the youth in this context is leaving the rural areas because of the lack of opportunities in the agricultural sector. I must admit that I would say I did not talk enough to this target group. From what I saw, they are organizing small groups and they sell their work to bigger plantations. And I guess in this youth forest agroecological zone, there are more opportunity also to work for bigger plantation for the small scale farmers. So I have the feeling they can mitigate this by working seasonally in the off farm. But this is more for men, and for women, and it would be, of course, different. Yeah.
One comment and one question. I mean, actually, your work, you should talk to each other. Because I guess what you are about to do has a lot to do with your analysis to understand this complex system of food production up to all the nutrition outcomes, right? And yeah, my question again is kind of the same like to the first speaker here. You say, on one slide you say agricultural policy should target women, and yeah, it's easy said. How would you design such policy? Again, if you imagine this country is a poor country, there are not a lot of resources out there, there are weak institutions, there might not be all hovels or any other schools out there. What would you do first?
Thank you. So, how to prioritize policies in a complex setting and with reduced resources? I think in this particular context now, where this case study is quite well highlighted that the dimension of availability, access, and stability was more or less okay, but the utilization dimension is the most problematic. So I would go for this policy, and as they are in an agroecological zone with a very diverse ecosystem, so a very diverse source of food, and I think I would invest in education, good nutritional practices to shift or to keep the good practices and reinforce them rather than to go to other crops that might not be so healthy, like bread, white bread. So yeah, I would definitely go in this setting, in this particular setting, on education and preventive measures, and nutrition, hygiene, and health. But then in another setting, I think it might be completely different. It would be another dimension, another policy.
There is one clarifying question from the online audience. So the migrating populations you were mentioning at the beginning in Côte d'Ivoire, whether these are migrants within the country or whether they are coming in from abroad.
So whether the immigrant farmers that I mentioned, that I named under the DULA, whether they are all Ivorian or also coming from neighboring country. They are in fact coming from the north of the country, but also from Burkina Faso and a neighboring country. But they have, it was difficult to access them to have a real view on their situation. But they seem to have the same cultural background and the same agriculture. Based on the cultural background, they have a farming system. They derive the farming system, and they seem to have equal specific issues regarding food security, while the Bauli have other specific issues based on their farming system and their cultural background and their consumption patterns.
Yes.
Just out of curiosity, can you explain, because it looks like we're talking about women empowerment, but at the same time, men are in charge of crops that are cash crops, and women are just in charge of really heavy crops, like harvest, cassava harvest is very hard for a woman, I must say, and youth doesn't receive a lot of income. So why is this split in responsibilities, so to speak?
This is a good question. This should be addressed in a workshop with both gender. Sorry. Why are men responsible of cocoa and women responsible of the subsistence crop? And why? Because cocoa seems to is the high provides a high revenue, and this is cultural. I don't have an answer, I guess, and that's no longer better informed me on this number.
I just ask you because in Latin America you have like cocoa, but the division of the tasks are the men are responsible for the maintenance of the crop, and the women are responsible for harvest and more like post-harvest, a big process. That's why I was wondering. Thank you very much.
Thank you.
Are there more questions? Yes, I just was about to say that we're already, okay. So there's a change in the program, so we'll have more time. Yes, I was about to say that we are already 5 minutes late, but so there would be room for more questions if there are. Yes,
I was just wondering whether you could, because you said you had to come back in May because of COVID, so you also collected data pre and post or after the start of COVID. Could you see already some impact in your data on shifting patterns due to the pandemic?
So the question is whether the pandemic has had, or if I could observe an influence on the farming system and the food security at this stage, and no. I did include a question in the questionnaire to see what was coming, but they seem to be very resilient to shock. Also, they had several political issues not so long ago, and when I was asking for the context, the vulnerability context, they never mentioned that, or they never identified that as an issue. And it seems to be similar for the COVID. They seem to be very confident that it will not have an impact on their livelihoods. But this was then very early in the crisis, and it probably has changed a lot since then. But their attitude was very confident, and I was surprised. Although it has changed how the exchange with Abidjan was working, but somehow they were not fearing it too much at this moment. This was in June, quite early.
What do you think determines this resilience you observed in the context of that?
It seems that since they rely mostly on their own production for staple crops, and that I didn't mention that there is a water dam not so far, so they can fish also in the region. So it seems that they can sustain their livelihood without too much contact with Abidjan. So when there are crises in Abidjan, people tend to go back to the villages and wait until the crisis is over, because they seem to have a quite sustainable lifestyle. In this region, I think if you're more in the north, it's much more complicated, I guess. And food security in this region is also not so high as in other regions of Côte d'Ivoire.
This research served at identifying these pathways, prioritizing these pathways based on a contextual or qualitative analysis. What do you think would be important indicators or maybe quantitative indicators to monitor in order to observe these dynamics between the production system and the nutritional outcomes?
Yes, so from this qualitative research, which indicator I would take to quantify food security in this context? Dietary diversity score would be, I think, one important indicator. And any indicator measuring the health status.
I think I've just received an online question, which relates a bit on the climate change window you have opened on the contextual side. So, which are the most important agricultural innovations or climate-friendly techniques which are adopted by the local farmers? Or these farmers respond? Are they responding and how to this environmental threat?
For now, they seem very. Sorry. From the climate change, what are the measures that farmers implement to mitigate climate change? What are the current techniques they have? And they did talk a lot about it, but they didn't have any solution. They didn't see any solution. And but a few have suggested to have more, because they have suffered a lot of deforestation, and they mentioned to bring back trees in their ecosystem. But this is a long-term measure, so they didn't have any solution. And the seasonal calendar is quite fixed, and they plant when they used to plant, rain or no rain.
Yes.
It's a question related to something I don't see here, which is really interesting, and that's highly processed food availability through markets. This is something we see in so many parts of the world, even in that really rural areas. You go into a store and the almost universal availability of processed bottled sodas or crackers and things. And I'm just curious, it doesn't seem to have hit this region from what you're showing. I'm curious, and whether that ever came up, sort of that market relationship with the modernized food system, shall we say, whether there were any comments in that regard.
So the question is whether highly processed food has come to this region and is available on the local markets. And I didn't observe any highly processed food. They do bake sweet things, but they do it themselves also with very processed flour coming from France. But all these exported products, they are so expensive that only very few people can afford it. So from what I saw, the only highly processed product that were worrying me was the white bread, replacing their nutritious food. That is becoming a trend, but it's also quite expensive. So it is only the wealthier household that can afford this bread.
Can I ask a follow-up to that?
Sure.
So that's a great opportunity to slow the issues of the double burden of malnutrition. Any insights from the qualitative work that you have that could inform the kind of policies and programs that you were talking about to really not only focus on continuing the traditions around the agriculture, but in reinforcing the traditions around diet to try to stop that from happening further and make sure that little trend you're seeing there with the white bread doesn't continue to spread to further processed products.
Any policy recommendation to continue improving the local consumption pattern, healthy local consumption pattern, and stopping the unhealthy transition. I think there should be a high investment in more community health worker that can promote at the community level the good practices and sensitize about these unhealthy habits. I don't know from the government whether they would put anything in place and whether it would be implemented. So I think both at the grassroots level is more effective in this context, sensitizing about the healthiness of various products and the richness.
Thank you very much. So for the sake of having 30 minutes of coffee break and also being able to follow the poster presentations, I will stop here. Thank you very much.
Thank you.